인도의 헬스케어와 라이선스 산업에서 유전공학 이런 제목으로 엑셀시스 제노믹스의 수렌다 치카 이사께서 발표해 주시겠습니다.
Morning, everybody, honorable dignitaries, ladies and gentlemen. I'm here to present on behalf of Babylon Group emerging science and technology in terms of the genomics and how it will be changing the scenario of healthcare, life sciences, and energy industry. Before I move on to the presentations and what are the opportunities are available in India and especially in Gujarat, and also the groups, what we are doing, and the few introduction slides. So our Babylon Group is very follower of Gandhiji's, and these lines is very deep to our heart, that independence begins at the bottom. So that means if we want to reach the society and build the nations, we must work for a lower strata in the society and raise their status. And so we have, with these lines, our groups basically have been in various segments, clean energy, agri-sciences to support the clean energy initiatives, and the commissioning plant company which is supporting the development. Accelerates is a part of the research and development, and some social initiative which is an educational and Poon Kumbha. The Poon Kumbha is very good initiative basically in a part of the energy programs. So starting from the biopellets, biopowers, biofuels, the waste management, generation from the energy from the waste. We've been working last 2 years into these segments and infrastructures. The agri-sciences is supporting to generating the biofuels, the plant which have been used for the biofuel generations, and this Poon Kumbha vision is wealth from the waste. So all the agricultural waste will be collected at decentralized locations, and they'll be used by the Babylon clean energy models to generate the energy, R&D, and solar energy. So you can see the group have well integrated opportunities. So how this model basically is working, and how this the energy generations has been going on in that. So you have farmers which are generating the various agricultural waste, which will be decentralized collections, is called as the Poon Kumbha hubs, where is in various locations into the Gujarat and spreading across India, and then moving towards this shredded biomass to the production plant, and the production plant we're producing the energy. So look at the Gujarat here. So it's meet the energy demand 40% of the renewable energy by 2020, and 2,900 megawatt biopowers, which is 1.75 million tons, and CO2 emissions can be cut down by using this. And another opportunity to use as a green energy, like firing with these biopellets with the coal, so you can reduce the burden of the carbon dioxide into the environment. This is the plant which we have operational, 350 tons per day productions, and we have been coming out with the other plants. We are also started to present a manufacturing facility into the Ghana. So as a part of the Accelerates, what are we doing in that, and how these genomics are being changing into the role of healthcare. You are all well aware that these two landmark papers in early 90s has been given a change of the scenario how these technology in healthcare and other emerging areas, especially in agriculture, have changed the scenario. So Accelerates has been is one of the leading genomics company established in the way back 2005, and these emerging technologies coming out into the market, and we are now the largest genomics company in India, located into the Gujarat, and spreading the genomics into all over the country. We have received in 2009 outstanding contributions awards from the Nobel laureate Dr. Richard Roberts in 2009, and the continuous as a part of our journey. So we have various accreditations. There's a few glimpses of the labs. We've been working with the state-of-the-art technology using into the genomics. This is one of the highest infrastructure cluster. We have a 600 core machines with the 5 terabytes of the systems which are been handling large and big data centered. So the goal of the group is to working in a healthcare and genomics area This is one of the major area in a dairy industry. We are building up is a new emerging area which is called as the cattle genomics, which is to build the genetically strong herd for a quality and healthier milk production from these cows, diagnostics and the collaborative area. So what this genomics is going to play an important role when we are talking about the renewable energy. So these are the three major segments: the cellulosical biomass productions, sugar and biofuels. If you look at in the three area, the genomics is indispensable, and XLS is producing efforts to really working into all these three areas. So the first is you develop a plant which are very low life cycle and have a more cellulosic component and low lignin components. So this is one of the part which genomics play an important role. The second part is you construct the enzymes which are been highly degradable to the sugars and convert into the biofuels. And these are the genomics technology has been used to discover novel enzymes from the environment, from the sea, from the soil, from various environment. And then in the biofuel, where you want to get synthesis and engineer metabolic pathways, and you want to produce and divert the organism, especially single cell organism, towards produce more energy, what you're looking for. And the genomics is the only solutions which can provide the answer for all these questions. These are the few glimpses of it. The large scale projects has been going on, especially on the government of India and the Directorate of Research and Excel-based genomics for producing a plant which can have a large capability of the oil productions, disease resistance and salinity tolerance basically in the traits. The second major project is Excel-based is the rice projects. Everybody know the food is going through the crisis as the population is increases, so you have a various solution, environment is changing and the agriculture productivity is impacted by that. So this is one of the projects which we are trying to identify that in the stage when you have a problem in a drought stage, how you can enhance basically the grain yield by using these programs. The next of the program is called as the molecular diagnostic programs in terms of using genomics technologies for a cancer diagnosis, hereditary disease, infectious disease, molecular diagnosis and drug resistance. So all these are been happening in the state of the Gujarat. This was one of the smallest, when we are talking about the technology, we are talking about mobile technologies. So this is with the collaborations of the Eastern UK, XLS has built up one of the point-to-care diagnosis devices. It is not only just back to sites. So you can take these systems, go to the patient sites, localization centers, and then you can look for. So XLS are looking such collaboration from the courier company because the courier friends and the companies are high into the technology. So we are also looking for such more collaborations. If you look at this device, is a point-to-care platforms, thermal engine, dual RAM processor, and see, it's just a very simple procedures. Put your samples into this cartridge, plug here, push the button, and thus you know what is going to happen in that. So these are the technology which are emerging and coming into the Indian market, and XLS is playing a very important role basically. So what you have, apply your sample in a paper-based technology, you put your sample, spread it, take a punch, put into the cartridge, and 30 minutes you will come to know what is happening into that, the assays which you have been using, whether you are infected or not infected, and then your results will be available in 30 minutes. This is another program, is one of the largest programs we have been working on that. It's called as the Next Generation Genomics Diagnostic Program. We have been integrating the different ways that you're generating a clinical samples, identifying the variants, making a clinical risk analysis, do all these gene interactions and moments, and finally all the information goes into the XLS database, and then it goes to the clouds, and then finally goes to the clinical health report where doctor can understand. And the simplest way format, because this area is very complex, which clinicians is not able to understand, but in that format is a visible format, the clinician may be able to understand into that. One of the initiative, as you know, the health human industry in the healthcare, there's a lot of the disease which are not been aware, which is called as a rare disease. And XLS has the pioneer into have built up the ones of the world database, which is called as a rare disease database, where you know the information what this disease is, how it is look like, what this disease is controlled, and what is the role of these disease, and what are the medicines are available for the disease into one single site, which have been contributing basically into this particular segments. So this was the works as a part of the Abalone Group and XLS we've been doing in Gujarat, and spreading the genomics into the segments of the biofuel energy, agricultural segments, and the healthcare segments. So if you look at the opportunity in the markets in India, the global market is estimated $11.1 billion in 2013 with have a CAGR compound growth rate as a 12%. And this segments, 60% of these segments are consumer, that means they're technology driven and manufacturing driven. And this segment is continually growing, and this largest technology is the PCR segment, which is a point-to-care device, and other technology which are going to be done. If you look at the other point of view, there are the 4-5 major areas which these technology or these markets are growing into India and Gujarat. The one is a biopharmaceutical, which is novel biopharmaceutical is one of the emerging area which focusing in that. Bioservices, which include the clinical services. Bioagriculture, basically using the genomics, agricultural practice and genetics, and to produce a higher yield crops in that, and the genomics. And this is a new emerging area which is called as RX informatics, which basically is providing information to clinicians and doctors, not only the human area, but including the animal area, dairy industry area, and also other. Because in a dairy industry, you also have a poultry industry and other animal industry, you have a problem of the disease spreading and where this disease is spreading. So this technology is really coming up and managing these particular area. If you look at the global opportunity in the healthcare, in particular India, which is healthcare sector, which is having a growth of 15%, and you see that the demand which is raising is to $80.7 billion by 2015, basically. So this is the market opportunity in India which is emerging in that. And this growth is driven basically by healthcare facilities, private public projects, point-to-care diagnostics, NGS-based diagnostics, pathological laboratories, and healthcare insurance sectors which are emerging into India. And what are the policies, what are the opportunities in India if you look at that? So they are the 4 components, but if you see these 2 components, one is raising incomes into the India, the greater health awareness, lifestyle disease increasing, as well as the contributing into the strong demands into the healthcare in India. And the policy support from the government is one of the sector which are providing a conducive environments to grow the business, and especially Gujarat is leading into these initiatives, and many healthcare industries has been coming. And in this healthcare industry, if you look at, there are the 5 segments. One is the hospital segments which are emerging, pharmaceutical segments, diagnostics, medical equipment and supply, and medical insurance. These are the 5 major growth segments which are coming into this. And if you look at this, Indian healthcare, which are really posed to a next generation growth, and they are the 3 different parameters. One is the demand which are increasing day by day, the policy support which governments and other supports, the financial supports is provided, and then basically increasing the investment into these segments of, especially into 3 areas where you have a rising FDI in the private sector investment, and then you have merger acquisitions, and also strong supports into the R&D developments. So what are these opportunities, especially into the India, and especially the India and Gujarat and Abalone groups and accelerators? So we can have one is healthcare infrastructures. If you look at the demand which are required is 1.8 million beds are required to achieve 2 by 2 beds per 1,000 people in 2015. And to support these, you need a doctors, which is 1.4 million doctors are required to support these kind of infrastructure into India. So investment is required is about $86 billion to achieve these objectives. And similarly, you look at the contact research, diagnostic and genomics, which is fast growing segments, and the pricing which is a 60% lesser into the other markets. And the genomics is really a new markets which is emerging as a very strong opportunity to invest basically into the segments as a diagnostic. Point to care, healthcare, diagnostics, medicines, and is going to be basically is important into this area. And the last is the medical tourism. India medical tourism is going as a 30%, is a 2 billion industry, and the cost of the surgery is 1/10 from that, and investment into 3D printing is one of the opportunity. And I say these are the few accolades which have been received as a part of the Abalone group. And in the last slides, you come, make in India, collaborate with Abalone and Accelerators. We are happy to invest into the technology. Thank you so much.